Papua New Guinea is on the precipice of a COVID disaster.
There's every reason to believe we've already got an out-of-control epidemic that is growing at around 3 or 4-fold per generation.
Testing rates are low, but positive results are disturbingly high, as much as 8% in one Port Moresby maternity ward.
We desperately need the vaccine because our health workers are getting infected at an alarming rate.
And the PNG health system is already stretched to the limit. Not only a potential humanitarian disaster for PNG, but also exposing a COVID weakness in Australia's northern border.
Of course, our first thoughts are with and concerns are with Papua New Guinea itself, but there's a strong self-interested reason for us to respond strongly.
The federal government today announced it will be sending urgently needed medical supplies.
Our government will also be moving immediately to gift 8,000 doses of our COVID-19 vaccine stocks from our domestic stocks to support the vaccination of frontline health workers in PNG from next week.
PNG's inability to control infectious diseases has long been identified as a threat to Australia, especially in the Torres Strait. Over a decade ago, the threat came in the form of drug-resistant tuberculosis, which required Australian help to contain. COVID could prove to be even more difficult.
In all likelihood, we have thousands of cases there at the moment, and that means in a week or two, it'll be tens, if not hundreds of thousands.
So Queensland last week fast-tracked its vaccine rollout to the Torres Strait Islands, just kilometres off the PNG mainland.
A very positive response from the community. They're very health aware and aware of the risk of coronavirus to themselves and their families, and there's a real community feel and spirit about protecting one another. We're seeing that borne out with good numbers coming into the clinic.
A Queensland health vaccination team is now on Saibai Island, where it plans to vaccinate the adult population of about 250 this week, before moving on to Boigu and Duan Islands, the populated areas closest to the Papua New Guinean mainland. The other side of this narrow strait is PNG's Western Province, a remote region where there's been little, if any, COVID testing. Most of the PNG COVID cases we know of are in the capital Port Moresby. Is there any evidence of COVID in the Western Province?
It's very difficult to give a straight answer to that. How much coronavirus is or may be in the Western Province is a bit of an unknown.
What we do know is that COVID cases are beginning to spike in Port Moresby. The recent funeral of the country's founding Prime Minister, Sir Michael Somare, is considered to be a possible super-spreading event.
You saw how much difficulty developed countries such as the US and the UK have dealing with their COVID surges. Can you imagine trying to do that in a health system only 1% as well equipped?
The COVID-19 ward at Port Moresby General, they're getting full very quickly, and now medical wards are being taken over by COVID patients.
Professor Glenn Moeller is one of PNG's leading obstetricians. The 74-year-old doctor is now in quarantine in Cairns so he can get vaccinated. Too many of his staff have contracted COVID.
We're losing about 10 midwives, doctors, nurses about every week. And 10 is like 5% of our workforce.
While the Prime Minister today said Australia would send medical supplies such as masks, gowns and ventilators, Professor Moeller says the most important element is the promise of vaccine doses.
We need 5,000 to 10,000 doses right now to start protecting our health workers.
It's a distressing time for PNG expatriate Olive Tal Davis. Now living in Cairns, she fears for her family back in Port Moresby.
Back home, it's a village environment where socializing is very much part of the community life. So there's no such thing as social distancing. And with limited resources, no one's going to wear masks. There are others who think that COVID is a hoax.
Misinformation around COVID and around COVID vaccination, which is rife there. It's very big here, but it's an even bigger problem in PNG.
Timing is crucial. While PNG may need more help in coming months, the vaccination of frontline health workers can't come soon enough.
It's worrying a lot of us who live in Australia, knowing that we're okay, but back home it's not.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.